Hello, my name is Angela Wolfe, and I'm a Pharmacist Candidate from California North State University. And today I'll be talking about the antiviral medication called Molnupiravir. I'll go through some patient counseling points, such as what the drug is used for, what you should tell your doctor before taking the medication, and some things that you need to know while taking the drug, as well as side effects, how you store the drug, how it is best taken, and what to do if you miss a dose. So Molnupiravir is a medication that's used to treat COVID-19 in the outpatient setting, specifically for patients who have underlying diseases that put them at higher risk for complications from COVID. So some things you should tell your doctor before taking this medication is if you have any allergic reactions to this medication or any other medications or foods. Also, let your doctor know if you're breastfeeding. We want to make sure that you don't breastfeed for at least 4 days after using this medication. You also want to let your doctor know about any of the other medications you're taking, whether that be prescription, over-the-counter, or vitamins or supplements, as well as any other health problems you might have. So some things that you should know while taking this medication is do not take this drug for longer than you're told by your doctor, as well as making sure that after you receive the medication that you continue to quarantine yourself and do other things to control infections, like keeping sterile surfaces and making sure things are clean so that no other people are exposed. So some side effects you should look out for and call your doctor about right away is if you take Molnupiravir and you experience something like a severe allergic reaction. You might see something like a rash or hives, tightness in the chest or throat, as well as trouble breathing, any swelling of the face, lips, or mouth, or even your throat as well. Some other side effects of this medication can include diarrhea, upset stomach, and dizziness. Now, in talking about storage for Molnupiravir, you want to make sure that you store it at room temperature and in a dry place. You want to make sure that you also keep it in a safe space away from kids or animals. When taking this medication, you want to take it with or without food. Make sure to swallow it whole. You cannot crush or chew this medication. It's also important that you don't miss any doses during your treatment. Now, if you do miss a dose, you want to take it as soon as you remember, but if it's been 10 hours or more since you missed your dose, you can go ahead and just skip that dose and go back to your normal routine. Make sure not to take any extra doses, and if you're not sure what to do, just go ahead and call your doctor. So Molnupiravir, like I talked about earlier, is used to treat mild to moderate COVID-19 patients in the outpatient setting who are at higher risk of progression to severe illness. Some drug-drug interactions include a medication called cladribine. What happens is Molnupiravir can decrease the therapeutic effect of this medication. Now, talking about Molnupiravir's mechanism of action, it's metabolized and phosphorylated to an active form called ribonucleoside triphosphate. And this active ribonucleoside triphosphate is then incorporated into the SARS-CoV-2 RNA, which results in the inhibition of viral replication. Now, Molnupiravir is used in adults at the age of 18 years or older. The dosing is 800 milligrams every 12 hours, and the treatment duration is for 5 days. You want to make sure to initiate Molnupiravir as soon as possible after diagnosis of COVID-19 or within 5 days of symptom onset. Now, it's required that they complete the 5-day course, But if they do miss a dose, they want to make sure they take the missed dose within 10 hours of the normal administration time. If you miss a dose anytime after 10 hours, they can just go ahead and skip that missed dose and take it as soon as the next scheduled dose comes up. Now, it's noted that we shouldn't use this medication in any patients under the age of 18 years old. There is a potential for bone and cartilage toxicity in younger patients. Now, in terms of dose adjustment in both renal and hepatically impaired patients, there is no dose adjustment necessary. When patients take this medication, they can take it with or without food. We just want to make sure that they're swallowing the capsule whole without breaking open the capsule or crushing or chewing the capsule either. So some side effects that may occur with the use of Molnupiravir are diarrhea, nausea, and dizziness. But these adverse reactions were listed in the FDA-issued emergency use authorization. They weren't at a greater rate than what we were seeing in the placebo group. You can refer to the EUA for more information regarding reporting adverse reactions. And there are no contraindications to the use of Molnupiravir at this time. A warning for the use of Molnupiravir is its effect on bone and cartilage. It was observed in animals after repeated dosing that it had an effect on bone and cartilage toxicity. So Molnupiravir is not authorized for use in patients under the age of 18 years of age, just because of its effect on bone and cartilage growth. We want to make sure to use Molnupiravir cautiously in women of childbearing age because it may cause fetal harm. So we want to advise our patients to use effective contraception during their treatment as well as 4 days after their last dose. For monitoring of Molnupiravir, we can look for symptomatic improvement, which can be indicative of efficacy. And this concludes my presentation on Molnupiravir, and provided here are my references.